Do you know diabetic foot is a common and a preventable problem? I'm Dr. Achintya Sharma, Senior Consultant in charge Department of Vascular Endovascular Surgery at Max Shalimar Bagh, and we proudly invite you to see our diabetic foot lab, which is going to be a game changer in this north and northwest district of the town, where we are going to provide comprehensive care to diabetic foot patients. India being the diabetic capital of the world, diabetic foot has become a common problem seen in our population. Diabetic foot is a misnomer which, not diagnosed at a proper time, can lead to amputation. And the goal of a vascular surgeon is to have amputation-free India. Diabetic foot primarily happens because of uncontrolled diabetes, which can lead to a blockage in the arteries. Blockage in the arteries means कि हमारी खून की नाड़ियाँ block हो जाती हैं, which can lead to blackish discoloration, gangrene, and at the end of the day, amputation, which is a significant mortality and morbidity. Mortality is almost 2 to 3% of patients with diabetic foot will die invariably, and with India emerging from a third world to a progressive country, diabetes is on rise. So how do we diagnose diabetic foot? Diabetic foot can be diagnosed by just a simple clinical examination, by examining your pulses. Diabetic foot is a multimodal problem. Not only vascular, but nerve endings also become weak. To treat a diabetic foot, it is not only a vascular surgeon but a multimodal team which is involved, which involves a physician, diabetologist, podiatrist, and wound care management. If you consult a vascular surgeon, he can advise you basic tests, check your blood supply, check your sensations of the foot, and if they are normal, it is very much preventable. In our diabetic foot lab, we are going to do all comprehensive tests, which involves blood investigations plus diabetic foot vibratory examinations, sensory examination, physical examination where we check the leg if there is any cut or wound debridements, plus blood flow examination by doing an ankle brachial index or pressure measurements. This will help us to identify any injury, whether it is sensory, arterial or peripheral arterial disease blockages can be comprehensively checked in our diabetic foot lab. So we ask all patients with diabetes to come and get self-examined so that early identification can lead to prevention is always better than cure.
Subscribe to our YouTube channel and press the bell icon to get the latest healthcare updates.